So there's a video. She's sharing her experience of losing her vision after getting aesthetic treatments in Korea. Just prefacing this video by saying that I have no intention to speak ill about any brands or any doctors. I'm just purely giving my opinion, alright? So let's just start.
Surreal, so I didn't want to do this, but I permanently lost my vision in my left eye after a skin treatment in Korea. I didn't get surgery, I didn't get filler, I got what I thought was a very harmless skin booster, a collagen stimulant called Juvelook Volume. And when
Okay, so for those who don't know, Juvelook Volume is a hybrid dermal filler. It's content of PDLA and HA. So PDLA is a form of collagen stimulator and HA is hyaluronic acid. So combine these two gives you a hybrid kind of dermal filler. So it's being used for dark eye circle, tear trough, laugh line injections, even cheek augmentation, right? It has another range called Juvelook. So Juvelook has lesser concentration of both material, but is for skin hydration, pore size, and wrinkles reductions, right? So those are for skin quality improvement, and for Juvelook volume, it's for volumizing, right? For augmentation. So oftentimes they inject in around the eyes to give you a rejuvenation look, right?
when the injector injected near my left side, I just couldn't see immediately. And I vocalized this many times.
Okay, so I assume that she said injected on her left side means around her eye on the left eye, right? Vision loss can happen everywhere in the face, right? So it can happen whenever you're injecting laugh line, your puppet line, your chin, your cheek, or your temple. It can happen everywhere, even nose.
The thing is, the injector was a doctor I really trusted, so I wanted to trust them. They kept reassuring me that it was a side effect from local anesthesia. The next day,
Okay, I'm not sure about side effects of local anesthesia will cause vision loss temporarily, but yeah, think about vision loss is the number one disaster in aesthetic treatments. What happened here is probably a vascular occlusion because of the product going into the vessels. So it blocks the blood from carrying oxygen to the cell, and that can cause permanent blindness. In this kind of situation, I usually rather overestimate the severity rather than underestimate it.
it felt the same. I went to the ER, but because I went in and got injected on a Friday, I just couldn't be seen. They were like, literally, if you need to remove your eye, we can see you, but for everything else, we can't. I ended up going to different ophthalmologists, and they later would confirm that I had blockages in the branch arteries of my eye. And these branch arteries feed oxygen to the retina. So they're
Okay, so for retina, there's a main artery called central retinal artery that will provide blood flow, oxygen to the entire retina. And this central is like a tree trunk. It branches off to the small artery called branches of the retinal artery. So what happened here is part of the branches got blocked because of the filler getting in, and that blockage causes ischemia, means lack of oxygen at that area. And yeah, this thing can cause partial vision loss. And if the central retinal artery get blocked entirely, then you lose the entire thing. Then you can get total blindness.
There are parts of my retina that are now dead. For example, if I look at my husband, I can't see his face. It's like erased. It's not blurry. It's dead pixels on a screen. I can see the top of his hair and slightly above him, but anything I focus on, whenever I move my eye, it's like completely erased.
So from her experience, she has partial image that cannot see at all, and she still have some vision that's still preserved. So that means that it's really just the branches of the retinal artery occluded, right? So yeah, it's really sad to see this happen.
And it has been so traumatic. It's been a nightmare because, as you know, I'm a designer and I'm a ceramic artist, and my livelihood is based off of what I see. I don't know how, like, I'm not sure, like, what this new reality will look like. I arrived in Korea.
Okay, so I think in aesthetic medicine, right, the tolerance for side effect is really, really low and next to nothing as compared to like a traditional medicine where you, for example, if I had an infection and I got admitted to the hospital and they have to do certain procedure or prescribe certain medication that have side effects, I, the tolerance for side effects because of my infection is really is higher. Not to say that I expect there will be some side effects. It's just that the tolerance for side effects for aesthetic medicine is lower because the patient coming in, they are well, right? They have no issue except for the fact that they want to improve their appearance, right? It's not like they are sick, they need certain treatments to make them healthy again, right? They just want to look pretty. So that's why where it's very important for us to recognize any warning signs early so to avoid this thing happen.
March 1st, and we're halfway through April, and I'm still here. I really want to go home, but for the past month, we've been trying all these experimental treatments, holding on to a shred of hope that something would work, but nothing has worked because we missed that crucial golden hour. So, yeah.
So the golden hour that she mentioned here is the period of window whereby the cell in the retina still is reversible, means that we still can save it. The thing about retinal cell is that they are very sensitive to oxygen level. Once they are below whatever that they need it required to survive, they will start dying. And once they start dying, sometimes if you drag it long enough for more than 2 hours, damage is permanent and the loss of vision will be permanent as well. That's why it's very crucial for the physician to recognize the signs early on and try not to brush it off and pay attention to the feedback from patient.
Doctors are saying it's permanent damage, and so now we're like working towards reaching a settlement. I just fear it won't be fair compensation because this will impact my career, my future, and there's just so much uncertainty on how I can live a fulfilling life after this incident. It's been emotionally, mentally, financially draining. My husband actually flew home the day I got my skin procedure done, flew back in to Korea the moment when he realized something went awry, and he's been on negative PTO, and now he's on unpaid leave, and just navigating the Korean medical system and trying to understand all this jargon that we don't understand. It's just been so hard. I think people go to Korea and do all these skin treatments thinking that it's like an easy and quick thing, and that's what I thought too, even though I did research Juvelook for over a year and thought it was safe. But something like this happened. I became a statistic somehow. And so I just want people to be aware that things like this could happen. I thank you for watching all the way through. And I'm just hoping that this never happens to you or your loved one. I feel like.
Okay, so being a statistic actually meaning that it can happen, right? No matter how low the possibility is, these things still can happen. That's why we as a physician, we spend a lot of time and money to go and learn the technique of injections, to perfect our injection method so that we can reduce the risk down to really, really minimal. Every patient face, the vessel is different, our anatomical features is different, so we have no way to be sure this injection method is gonna work every time without any issue, right? So we always like go and learn where or which approach is the safest way to go. Even though safest way doesn't mean that it's 100% safe, right? It's just relatively safer. But I'll take any percentage I can get trying to reduce this thing, because this thing, as you can see, it's very, very traumatizing and it can really derange the person's entire life. So I think for physician, we have to recognize the sign early, act fastly. Yes, every procedure carries a risk and patient has to be well informed and doctor has to know what to do if things like did happen. Okay,